All right, we are here today with a full mouth reconstruction using Straumann implants and the Smart On X denture conversion with my buddy Dr. Frank Mack. And we place these implants, I want to be really picky about the angle. These implants are placed obviously in the right amount of bone, but I want the abutments to be placed appropriately. So that way the screw access channels for the conversion and ultimately the final prosthetic is correct. And sometimes you've got excessive bone and the abutments you want to use aren't going to work that great, especially when picking up these tie bases. So we're going to do some bone reduction where necessary. And I like to use these jigs from Straumann. It's basically a replica of the abutment that I want to place. And then the tie bases, which are coated with acrylic, which we're going to pick up with our denture a little bit later in this video, they have the breakaway screws in there. I want to make sure that this tie base is coming out of the gums at the right angle, at the correct height. It's not too low, it's not too high, so we can have a successful case. And once I've done that, then I'm just going to rinse and repeat. I'm going to go in, I'm going to start placing the other abutments, maybe changing from a 0 degree, in this case, to an angled abutment. And really at the end of the day, I want to set myself up for success. So when I do this conversion, I'm going to end up in a situation where the screw access channels are coming through the, occlusal table or, palatal or lingual. And in this case, here we go on the front tooth, I'm putting the carrier tool in there. And you can see here from the side that the screw access channel is going to come out through the palatal. And I don't have to worry it's going to be, coming through the, facial of the tooth or something. So that looks great. Okay, now once I've got all that squared away, I'm going to put the tie bases on. They have the breakaway screw in here, which is the magic of this system, as opposed to, tie bases that you have to drill giant holes through the denture. You don't have to do that with this system. The screw holes are tiny, which you'll see here in a few minutes. But once I get these all on here, I want to make sure that the denture can be seated with some passivity. So we're going to put a little bit of blue mousse in the denture, some Teflon tape over it, and I'm bringing this to the mouth. And really all I'm trying to do here is see if this thing will go down all the way over those tie bases. There's 5 tie bases. And it's possible that it goes down perfect the first time. And it's also possible that I have to go back to the bench and grind a little bit of this denture out a little bit so I can get this thing to seat, and making sure I pick up all 5 of those tie bases at one time. And you can see it makes little indentations on the Teflon, so you have to worry about, messing up your surgical site. So then I go back to the bench and I'm going to grind out a little bit more. And, usually I'll go back to the mouth again with the blue mousse, more Teflon tape. And again, trying it again. I want to make sure this thing's going down all the way. I'm not going to put myself in any sort of situation where, I've got the thing canted to one side or something funky like that. So it goes back in the mouth again. I get it to where I think it is. And, you might have to do this, more than one time to make sure you got it right. But once you feel like that, okay, this thing is going down, it doesn't look like it's canted one way or the other, then you're pretty much good to go. The next step is going to be to isolate the multi-unit abutment and the tie bases, so that way no acrylic seeps onto the surgical site. And the way that we do that is with this little rubber dam. And we punch holes in it using a jig. We had a little paper jig we made earlier where we knew exactly where these tie bases were. And I basically just stick this in. It kind of snaps on there really, really easily. And then we use O-rings. I know it sounds simple and crazy, but we use O-rings and push them over those tie bases. And it basically secures the rubber dam up against the tissue. You don't want any acrylic seeping underneath this thing when you load the denture in there to pull these tie bases off. That would be bad. It could rip the surgical site, rip out the sutures, and otherwise create a mess. So that's something you don't want to do. So here we go. We're going to go ahead and load the denture now. And we know it's passive. We know it fits. So we're going to take it to the mouth, flip it upside down, make sure that nothing's leaking out of there. It's going to be nice and the right consistency. And then we're going to just place it in the mouth. I actually went in a little bit to the right here because her head was a little bit tilted. So we'll have to fix that in the final restoration. We'll get that midline dialed in. But for this, it's okay. And I got my assistant blowing a little bit of water in there. And after a couple minutes, we're going to take a cotton pliers here, and we're just going to pry this thing off. It's going to break those peak screws. All 5 of them are going to break off at the same time. And as you can see here, once the rubber dam's removed, I've got all 5 of the tie bases. The 5 O-rings are still there, stuck inside of the denture, and I didn't have to drill holes through this denture to do this. It's pretty incredible. And now we're just going to go back to the bench. Now we're going to turn it into a screw retained prosthetic, basically. I've got some little caps on the intaglio there, so no debris goes into those holes. And I'm just going to start carving away the flanges, carving away the palatal, and ultimately what I'm trying to get to is this step where I'm going to drill through the intaglio using the special drills for the Smart On X. And look how small those holes are. The holes are essentially, they're the size of the screw that you're going to use to put this thing at the abutment level. It's really incredible. So this one drill bit goes through, you punch through to the occlusal from the intaglio, and then there's another bit that has a little stop on it that you go in from the other side, which is what I'm showing you right here. And this one will bottom out on the tie base, and it just makes the hole a little bit wider. And then you do have to ream out a little bit of the peak screw, which gets sort of stuck in there a little bit. But look how small those holes are. That's the size of the holes that we're going to use to screw this thing on. So it's not destroyed like most of these all-on-X conversions. You literally destroy the denture in the process of making the whole thing. You make giant holes in it, and this one's a little bit close to the end of the denture, which wasn't ideal, but it was totally solid, no issues, and we were able to screw it in without a problem. I like to make models for these things, so here I am showing the analogs and screw channel from the occlusal, and I'll pour this up, and I think there's a part in here. Yeah, so I'm going to come in right now with some gingival moulage and make a little gingival model, and then just pour this thing up. And then it's just back to the lab, carving. I think this might be the lower. I'm repeating the same thing on the bottom. Here I am drilling the screw access hole through the tie base to the occlusal, which is on the lingual, so nowhere near the incisal edges of these teeth. And then widening it a little bit, just like I did before on the occlusal surface. I'm going to widen those holes just a little bit, which is here. This is it right here. You can see I'm going through. I mean, the screw holes are really, really small, so there's no damage to this thing. And then we're going into the mouth. They fit like a glove because it came off perfectly. That means it's going in perfectly. So we're going to screw this thing in. It's miraculous how easy this is without having to go back in the mouth 5 different times. And I love the system. It's fantastic.